Hello everyone, welcome to All About Health, the show in which we discuss everything about medical travel in Turkey. Today I'm here with Nora, the medical advisor at Letsmedi. Hello Nora.
Hello, Semi.
Welcome.
Thank you. How are you?
Doing well, thank you so much. Thank you so much for being here. Nora, can you introduce yourself and discuss in a bit what line of work do you do?
I'm medical advisor at Letsmedi and I'm guiding patients about their treatment planning.
Patients who advise to Letsmedi for their health treatments, they're interested in bariatric surgeries and dental care and plastic surgeries. Today, I'm more interested in the teeth. Yeah?
Okay, that's perfect. And I'm here with my materials to show you what we exactly do. Firstly, I'm asking for intraoral photos from our patients because then I'm forwarding the pictures to our experts.
This sounds complicating, intraoral photos. What does this mean? Just sticking a cell phone in your mouth or?
Yeah, actually, we have a guide image which shows you the exact photos. I mean, like you take from this profile and this profile, from down, from upside of your
So
mouth.
the recipient can get a reading of what the mouth looks like more or less.
Also, they can see. We have photos and instructions, and they can take the photos so easily. So after I get them, I'm forwarding the pictures to our experts, and they are checking, examining their mouth, and then they can decide what we can do about this patient.
Each plan is sort of specific for the patient.
Of course. Some people need X-rays because it seems like they have problems with the bones. They have bone loss. So maybe they want implants, but they cannot work about this. So firstly, we have different treatments to get this specific treatment.
Okay.
That's why we need photos. Sometimes we need X-rays to decide this. So we cannot say just, okay, you get this treatment and this is the price. No, not like this. And then we get the treatment plan for our patients.
After the expert has analyzed the mouth and came up with a treatment plan, looking at the photos and the X-rays if needed, it is then you who communicates it to the patient, correct?
Yes.
You who tells them what treatment they advise to receive and why.
I'm directly forwarding the message. I'm also adding some things and personalizing the message. And I'm informing the patient about their treatment plan. And then sometimes they want different things and maybe the budget is not enough for it. So we are thinking about what we can do. There are different species about like porcelain crowns, Imex crowns, and also zirconium crowns. So we have to provide them a
treatment that fits their budget and their desired
also
look.
Appearance, you know. They say the appearance is not so important. So I just want the cheapest one and I want this one. So I'm planning the treatment again. So we are always communicating and we are also meeting their expectations. So we don't say this is the treatment and that's all.
I see. So every treatment plan you forward to a patient is basically not only specific because every mouth is different, but also specific because every person and their spending habits and their distance to Turkey will be different.
Of course.
What kind of treatments are there when it comes to dental care?
There are so many treatment species. So we have implant treatments.
That's when you miss a tooth, yeah?
Yeah, this have some different species also in it, like Olon 4, Olon 6, full mouth. Some people has a problem with the upper jaw and some people has a problem with the lower jaw. So our experts decide what is needed for that patient.
So these Olon 4, Olon 6, these are for full jaws, right? Not only one tooth, two teeth, but the entire jawline.
Actually, for the Olon 4, with the 4 implants, for example, the patient has a problem with the lower jaw. With the 4 implants, they are placing. Let me show.
1, 2, 3, 4. Yeah.
Yeah, exactly. They are planting the implants here, and with the just 4 implants, the full lower jaw is covered.
I see. So you've got the lower jaw fixed with just 4 implants.
Yeah. Also, we have a Hollywood smile design.
That's what I've heard so much about.
Yeah, so many people are interested in it. Actually, this is for people who have who doesn't have missing tooth, like maybe needed implant. So we can also do it with the implant. Actually, the name of the treatment is not Hollywood smile. It's just a
Smile design.
yeah. The main process is you are cutting the teeth, the surface. Let me show you here. For example, this was your natural tooth. So we are cutting the surface of it, and this is the crown.
Okay.
So this can be metal-based porcelain. This is the cheapest one, I mean the metal-based. There's also zirconium crown, also full ceramic laminate crown. With this, you cover the tooth, and the full mouth is covered like this.
I
so
see.
This is Hollywood smile.
So you can do this crown, shape this crown any way you like, so you can have more or less any mouth you like.
Yeah, some people want zirconium crown because zirconium crown is more natural look. It's like your own natural
But
tooth.
that, of course, depends on your physical taste, your budget,
Yeah, of course. Mostly the budget is important about choosing this,
the material for the crown.
material. This is implants. Let me show you like this. So we have this titanium part of the implant, and we are placing this to the bone of the mouth. And then we need 2 months, minimum 2 months, and usually like 2, 3, 4 maybe, depends on the patient. We need recovery time. It stays like this.
Titanium has the bond with the bone underneath.
Yeah, and we need recovery time because the bone needs to get better with the time. So we just put temporary crowns on it, so patient can eat and chew things.
But this is just temporary. For how long?
For 2 or 3 months.
2 or 3 months.
For recovery time. So when the patient comes, the permanent crowns will be placed. But after the healing process, then they will be lifetime long.
Some implants are a 2-time thing. First you do it temporarily, and then when it's
for
healed,
all
you come
implants, this is like this. Even for one implant, you need 2 visits.
I see.
Because your bone needs recovery time. You cannot directly put the permanent crown on it.
Because if there's something pushing this way, or you eat something, this can damage the bone underneath.
Yes.
Makes sense. Okay. I see more about some quick aesthetic treatments of them. So whitening or...
We have bridge treatment. For example, let me show you. This is here. For example, you have missing tooth somewhere and you want a quick time. You don't want implant. So the bridge treatment works like this. For example, this area is missed tooth, okay? There are neighbor tooths. Firstly, to cover this place, you are also cutting the surface of neighbor tooth. And then like this, for example, 3 crowns are coming and you just put them here.
Okay, okay.
So the neighbors will be also covered with the crowns.
As far as I understand, it's the 2 teeth here that you already have.
Yes.
And this one that you're missing.
Yes.
So the 3 of them, you just make a 1-piece cover for the whole 3. So all the pressure of this tooth is divided between the neighbors.
Yes, exactly.
And if you're only missing 1 tooth, you don't need a metal hanging down there to support it. You can support it with the other tooth.
Maybe your budget is not enough. Maybe you don't have time for this. So we can make this aesthetic appearance with the bridge. And we also have whitening process. This just take 1 hour or something like this. But about the whitening process, it depends on the patient. So if you get bleaching treatment and after that you just keep smoking and drinking so much coffee and using tobacco, the process will be hard for this patient because then result won't be like the patient wants.
I see. So to get the maximum effect out of the bleaching procedure, you need to follow some rules that the dentist gives you. Yes, of course.
This affects on this process because the teeth becomes whiter, so you just see that whiteness, and then
2 cigarettes later, it's gone. So there's the crowns, the implants, the bridges, and the whitening. I hear fillings are popular for the cavities, yeah?
Yeah, for the cavities fillings, we are experts using the white ones, so they are not like the old ones, like gray metal based.
Oh, yeah, in some people's mouth I see those shiny metal.
No, they are not using this. They are using the aesthetic bondings.
So it looks like it's
fillings,
part of the tooth.
They are giving the every treatment in our partner clinics.
So what's it like for the patient to have a dental treatment made in Turkey? Because I know you said for the implants they have to visit 2 times and there's a 3 month, 2 month difference. But some of these, like the smile design, can be squeezed into a week in Turkey basically. So how does it go? The patient arrives here and then they come directly to the dentist, or how do you plan their treatments when you learn about their travel times?
Firstly, we are getting their treatment plans. So for the every process, for the every treatment, like all-on-4, all-on-6, full mouth implants, for the implants, the schedule is certain. There can be changes, of course, for the patients. Maybe the patient needs root canal treatment or maybe tooth extraction. These are the extras, but the main procedure is same. So for the implant, the first day they will come and they will get the surgery procedure. So implants, these metal titanium things will be placed under the jaw. So first day it will be like this, and the impressions will be taken for the temporary crowns. So the second day, third day, it will be hotel rest time for the patient. And when the temporary crowns are ready, they will be a try-in session for the patient. So they will just check if it's okay with the mouth, if they can chew, how does it look. So if it's okay, if there is no changes, it will be finished for the first visit. But after 2 months, if there are changes, it will go to laboratory and we'll done the changes, and then it will again, there will be try-in session for the patient. So after that, they can turn back to country. And after 2 or 3 months, they will come for the permanent dentures for the implant treatment. Sometimes it takes 7 days, sometimes it takes 10 days for the second procedure, because this will be the permanent one. So they have to be almost perfect for the patient. It has to be comfortable. It has to look like a natural teeth. So that's why it can take like 10 days or something like this. For the Hollywood smile, 7 or 10 days. Some clinics makes it in 7 days, some clinics makes it in 10 days. The average is like this. For the Hollywood smile, when the patient comes, the first day, teeth will be trimmed. And then for the patient, there will be impressions will be taken for the permanent crowns. And also,
that's when you bite down a clay.
Yeah. Yes, exactly. This is a little bit disgusting, but it's necessary, unfortunately. And for the also temporary crowns, there will be impressions will be taken. And sometimes it's ready for same evening, sometimes for tomorrow. And if root canal treatment needed for these patients, they will be done in second or third day. So when the temporary crowns are ready, it will fit in mouth until the procedure is done, so patient can eat, and they look like a little bit like a vampire, you know.
When with the smaller teeth,
yes,
separate, of course.
So they don't want to stay like this. That's why we are using the temporary crowns. So sometimes at the 6th, sometimes at the 7th day. Usually at the 6th day, permanent crowns are ready. But there can be changes. That's why we are exceeding the time.
Because this is a day-to-day thing. So
yes.
Some doctors do their work one day and the rest is for the patient to recover. But with dentists, what I saw, they have to build on what they did the other day, every day or every 2 days.
Yes.
So there are slight changes according to the patient's comments as well.
Yeah, for example, we had patients, we had the permanent crowns, but we didn't paste them. So he checked, he said, this place is not straight, or let's change this place. And that's why it's ready on the 6th day. So if there are changes, it will be done. And on the 7th day, the permanent crowns are ready and the patient can go back to country with a new smile design.
Amazing, amazing. I've never had a medical advisor before. I hope one day I'm gonna have one. I want to ask you a question. Why is it useful for the patient to speak directly to you other than speaking with a hotel and with a dentist? Because as far as I know, you arrange all of this, yes? Yeah. When the patient decides to come, it's up to you to have a car waiting for them over there, to have them lodged somewhere to sleep at night, and of course the dentist appointments.
So maybe if you go to dentist before, they're always busy.
They are, aren't they? Yeah. They're either busy or on vacation.
Yeah, that's why, it's not so easy for the patient to communicate with them. They cannot plan everything detailed like I do. So I'm trying to find the best treatment for them, best timing and best price.
And I remember speaking with my dentist for hours about what to do and how to fix everything, but now that I've met you, I think it would be a whole lot easier to tell this directly to you because you speak the same language with the dentist, and then you can communicate with them better to provide the treatment for me. Thank you so much for your time here.
Okay? I'm here to help you with my best.
Thank you so much. Thank you everyone for tuning in. This has been All About Health with Nora. Bye.